These are the three most effective things we can do for pains around the hip. Firstly, we need to work out where and what the problem is with the hip. The three main areas you get problems in the hip are deep into the glute area, onto the side of the hip, right over the pointy part of the hip bone itself, and then very much into the front of the hip as well. We are Witty, Pask and Buckingham, Chartered Physiotherapists in Northampton. We have been the leading physiotherapy clinic in the region for 40 years. We treat bone, joint, muscle, tendon, ligament and nerve issues all over the body. Using manual and manipulative treatment techniques, shockwave and exercise regimes, we work to get you back to full health as quickly as possible. In the glute area, pain is usually very much deep inside. It's to do with the deep rotator muscles deep inside the glute. And they're found right in the side in here, and you find them right behind the hip bone, deep in the back, and they can be a tight pain related to spinal problems to do with the pelvis, and it can also refer pain off down into the leg. With this type of pain, you need to make sure that if you've got problems with the back and you've got the sciatica down, that's the sort of thing to get checked out with your physio sooner rather than later. Pain on the side of the hip, just on the bony part or tucked in just behind, is to do with a couple of structures. It can be to do with Trochanteric Bursitis, which is a fluid-filled sac which sits on the side of the hip underneath the iliotibial band. That can be very sore. It can be sore to lay on, it can be sore to walk, particularly getting up and moving around. You can also have problems with the glute tendon, so just deep up on the top of the hip bone into there. And that's more of a tendinopathy, which is a stiffness and a tightness to get going, but once it's got going, it's not too bad. Pains in the front of the hip, again, can be very deep. And if you find yourself sort of putting your hands in what we call a sort of a C sign in the front of here, and you're feeling it deep and it's crunching and catching, that's likely to be to do with the hip joint itself, and is very much one of those things to get checked out with your physio sooner rather than later. However, you can get problems with the numerous muscles and tendons which sit on the top of the hip. You've got deeper ones, if you like, called psoas and iliacus. You've then got rectus femoris. You've got tensor fascia lata on the side of here, and you've got stringy, tight areas in here. And if those are tender, that's to do with the tendons in the front of the hip, and that's lots of things that you can do with that before perhaps getting checked out. Before we get into the exercises that we're going to go through to help the most common hip issues, I need to check out to see if you have signs of more serious hip joint problems going on, of impingement and osteoarthritic changes. The first of those is impingement. And what we need to do is to ask you to see if you can bring your knee up towards your chest, gripping, pulling it up yourself. Has it got good range of movement, as we've got here, or does it get sore and stiff around this area? Compare it to the other leg, do the same thing one side, then do the other, and just see how they feel. So firstly, can you bring it up if that's comfortable? Then take it as far as you can, then bring it over towards your opposite shoulder. This starts to close down on the front part of the hip joint, and if that's starting to get sore, again, compare it to the other side. And then finally, can you add a little bit of internal rotation? So you bring the lower leg outwards, which turns the hip inwards. Does that cause any pain? Does that cause... You'll feel a little bit of pinch. Compare it to the other side. Exercise 1 is to do with pain deep in the gluteal muscles or your bum muscles. You start it off in sitting. You have the leg that's not going to be stretched out straight, and you bring the leg to be stretched with the foot over the opposite side of the knee. Now you use the arm to bring that hip across. Take it as far as you can into a stretch, and initially that may be enough. However, you can lean into that a little bit more, really twist around and pull it across, and holding this for a couple of minutes at a time. You can then add to the whole thing by using a ball, tennis ball, dog ball, in this case a lacrosse ball, and you place that underneath the sore area, and then you lean over it, keeping the stretch, maintaining the leg position there, working deep into that muscle, rocking, moving over the top of it to massage and stretch it out. If you feel burning, pins and needles, numbness, stuff going down the legs, then just move the ball a bit, because it means you're catching the sciatic nerve. Don't force it, a couple of minutes at a time, easing and teasing your way into it. So the ITB roller, the purpose is to get into this tight structure down the outside of the thigh. So if you lay onto the roller, top leg in front, bottom leg out straight, pressure down through elbows so you're supporting there, roll well over onto it, and then roll up and down, finding the really tight bits as you go. And then when you find those tight bits, linger and roll, work into them till they start to release off a bit, and then move on to the next bit until you find the next tight bit, and you're looking for a couple of minutes, a couple of times a day. Needs to be a bit sore. The third exercise is a hip flexor stretch, and the hip flexors attach into the ITB and add to its tightness. Desk jobs and sitting make this worse. The best way to stretch this is in a kneeling position, kneeling on the knee to be stretched, placing a pad or a pillow underneath it, having the other leg in front of you, and you can use the roller you've been using as a support to keep your balance. You start upright and you draw your core muscles in to keep the pelvis level. Keeping that tension, keeping that tightness, you then lean forwards into the stretch, which you'll feel in the front part of the hip. If you let it go, if you don't hold the core well enough, you won't feel the stretch, it won't be anywhere near as effective. So the key is always keeping your tummy tight, keeping your glute muscles tight, and just pushing forward through the hip as far as it needs to feel that tension in the front part of the hip itself. 2 minutes twice a day will get this lengthened out. Further exercise to lengthen some of the tight structures in the front of the hip that become a problem is to get into rectus femoris, which is one of the quad muscles. Be careful with this one, it can be quite delicate. It's deep in the front of here. The way you do it is you grab hold of your ankle. If you can't grab hold of the ankle, put a towel around it so you've got that little bit extra range. Start with the knee forwards initially, and then really work at tighten up through the core muscles and the bum muscles, and then keeping those core muscles held tight, take the leg back. You'll then start to feel stretch in the front part of the hip as well as down into the front of the thigh. Only take it as far as you feel that tension, don't force it. Couple of minutes, couple of times a day, particularly if you've got a desk job. If the stretches don't allow this to settle within a couple of weeks, then we need to get it assessed properly with your chartered physiotherapist to see if there are any underlying issues that are causing it. You can have problems in the lower back, particularly down into the pelvis and the bottom joints and the lumbar spine, which cause pain particularly down into the bum. You can have quite chronically inflamed, quite nasty tendinopathies in the side of the hip and into that bursa, can get really chronically inflamed and need a lot more active treatment, and they can need a lot more physiotherapy work into them to get it moving. And again, we need to look at the more overall biomechanical reasons that are causing that, with weakness in the bum and other issues down through the leg. Finally, certainly if we're getting persistent deep pains in the front of the hip, we need to check that out for impingement or other issues with the joint itself. So try the exercises, try the stretches. If it doesn't settle down, then get to see your physio.